Cefixime review. Cefixime is an antibiotic that belongs to the cephalosporin cephalosporin class. It does this by eliminating bacteria that are already present in your body. Cefixime is employed in the treatment of a wide variety of bacterial infections in their various manifestations. There are more applications for Cefixime that are not included in this patient information leaflet. Warnings: if you have ever had an allergic reaction to Cefixime or any of the antibiotics that are related to Cefixime, such as Ceftin, Cefzil, Keflex, or Omnicef, you should not take Cefixime. If you think you could be allergic to penicillins, you should let your doctor know. Before beginning to take this medication, if you have ever had an adverse reaction to Cefixime or any of the other cephalosporin antibiotics, including but not limited to the following, you should not take this medicine: cefaclor, ranaclor, cefadroxil, Duricef, cefazolin, Ancef, cefditoren, Omnicef, cefditoren, Spectracef, cefpodoxime, vantin, cefprozil, Cefzil. Ceftibuten, brand name Cedax, cefurazime, ceftin, cephalexin, Keflex, Cefradine, Velosef, in addition to other medications. Tell your doctor if you are allergic to any other medications, particularly penicillins, so that they can determine whether or not Cefixime is safe for you to use. There is a possibility that the chewable tablet form contains phenylalanine. If you have phenylketonuria, you should consult your physician before using this particular kind of Cefixime PKU. It is unknown whether or not this medication will cause harm to an unborn child if it is taken during pregnancy. Tell your doctor if you are pregnant. It is unknown whether Cefixime is excreted into breast milk or whether it could cause problems for a breastfeeding infant. You should let your doctor know if you are breastfeeding your child. While you are taking Cefixime, it is possible that you will need to cease nursing your child. The Cefixime suspension liquid contains sucrose. If you have diabetes and are considering using this kind of Cefixime, you should first consult your physician. What is the correct way to take Cefixime? Always make sure to follow all of the instructions on the label of your medication. Cefixime shouldn't be taken in greater or smaller doses, or for a longer period of time than what is prescribed. Cefixime can be taken with or without food depending on your preference. The chewable tablet of Cefixime needs to be chewed first before it can be swallowed. Just before you measure out a dose of the oral suspension liquid, give it a good shake. You can measure liquid medication using the dosage syringe that is provided, or you can use a special spoon or cup designed for measuring doses. If you do not already own a device for measuring doses, you should inquire with your pharmacist about obtaining one. This medicine has the potential to provide unexpected outcomes in some laboratory tests that measure the amount of glucose sugar present in the urine. Make sure that any physician who treats you is aware that you are taking Cefixime. Take this medication for the whole amount of time that is given to you. It's possible that your symptoms will go better before the virus is totally gone. Skipping doses can also raise the likelihood that you will develop a secondary infection that is resistant to the antibiotics you are taking. An infection that is caused by a virus, such as the cold or the flu, cannot be treated with Cefixime. Keep away from moisture, heat, and light while storing it at room temperature. The oral liquid can also be stored in the refrigerator if you choose. After a period of 14 days, any liquid that has been utilized should be discarded.